So I have had so many parents who have children with ADHD really struggle with the mom guilt or the dad guilt or parental guilt and feeling like their bedtime routine is not good enough. I'm here to tell you that we can adopt an attitude where we move from the perfect bedtime routine to a good enough bedtime routine. And that's the key. I'm Dr. Funke Afolabi-Brown. I'm the founder of the Restful Sleep Place, and we help families thrive through good sleep. So there are many things that you'll see out there: the best routine, the perfect routine, the sleep hygiene, and all of that. And one of the things that I notice with families with ADHD is that they start to get overwhelmed and start to pile stuff on stuff on stuff on stuff. And I cannot tell you how frequently when families come to my practice and I say, "Tell me about your bedtime routine," and they are listing this 8 to 10 activities trying to get the child to bed. No wonder everybody's exhausted. No wonder there's so much bedtime resistance. And no wonder why sleep is in short supply. So today we're going to be talking about the 3-2-1 framework of the good enough bedtime routine. We're always embracing progress over perfection. And I think that is so key when it comes to children with ADHD. So we're going to talk about 3 non-negotiables. We're going to talk about 2 or 3 what I call sleep anchors. And then we're going to talk about the one flexible bedtime menu. Okay, so let's get started. And if you have not subscribed to this channel in the past, I want you to do so right now. This is so powerful and we share so much good content that you don't want to miss it. All right, so what are the 3 non-negotiables? I would say one is the body in the bedroom. This is just a non-negotiable. You need to have your child in their bedroom at a certain time. And then the second thing would be a safety piece, right? So when they're in their bedroom, they stay in their bedroom. And then the third is one biological essential. So let me give you an example of what that means. So body in the bedroom does not mean asleep at that time, right? So it may be that you have 8:15, they need to be in their bedroom. That is where they need to stay. Even if they don't sleep until a little bit later, we'll talk about how to modify things a bit. Because if they're running around the house, and this is something that we know in some children with ADHD, they may not be able to fall asleep until 8:30 or 9. But that doesn't mean they're just playing around the house until then. You can have things in such a way that they can start to wind down in their room, especially when you have an older child, so that, they don't feel like they're disrupting the house and they're not getting amped up. So, but in the bedroom, the safety issue is key. When they're in their bedroom, they shouldn't be kind of walking around or things like that, because by then, maybe, folks are getting ready for bed. You don't want them to trip and fall down the stairs or things like that. So safety is key. They need to remain in their bedroom. And then the third is the biologic essential. So they need to take a bath or brush teeth or at least wipe their faces or change into pajamas. And the reason why I say one is sometimes doing all 4 may be overwhelming for your ADHD child, depending on the kind of day they've had. So you have to pick your battles. Remember, we talked about progress over perfection. So find that biologic essential, right? So either they at least change into new clothes, take a bath or shower, brush their teeth, wipe their face, something of that. So you pick at least one biologic essential. So those are the 3 non-negotiable. Then the second I would say is the 2 or 3 sleep anchors. So these sleep anchors, think of them like cues, right? That will set them up for bedtime. So make it something that can help with that sensory signaling. So for instance, it may be certain scents. So you may, like, if you have a lavender spray, you want to spray it on their pillow. You want to start to dim the lights maybe after dinner. Again, it's sort of in their subconscious, it's within their awareness, right? But they're not fully aware that things are changing. And when you start to do this again and again, their bodies start to anticipate sleep, their brains start to anticipate sleep. You may do like a weighted blanket, a massage, something that is delightful for them. It might be movement, maybe some stretching or breathing. So again, 2 or 3 of those. You don't want to pick 8 or 10, right? That's too much. So maybe just pick, maybe you'll do the light dimmer, and maybe we do some breathing exercises, or the family just does some light movement, right? So that's really important. And then one is one flexible bedtime menu. So what does that look like? It's really around them choosing their own wind down activity. So you may choose between, playing quietly with Legos, or, reading a certain book, or listening to an audiobook. So that is something that they can then have their own choice. They may want to do some coloring or some drawing or just reading their own book. That's a flexible menu where you're giving them that one option of what you want to do tonight. You see what we're doing? We're still creating routines, but within the routine, you're empowering your child and creating some flexibility. And I think sometimes, especially for ADHD brains that are constantly seeking novelty, building that in is something that's important. Now, don't get me wrong. If your child is used to sort of the very rigid routine and it works, please, please, please continue to do that. I'm really talking more about those families where the child is really pushing back and everybody is struggling. So let me tell you about a patient I saw. Of course, I'm going to hide their name for identity's sake. Call his name Jake. So Jake is the 7-year-old, has a history of ADHD, super restless, really has a hard time settling down for bed, sometimes wakes up in the middle of the night, really struggling in school. Of course, as usual, when they come to see us at the Restful Sleep Place, we've ruled out any medical comorbidity, which I think is very, very important, right? If they have restless leg syndrome, if they have micronutrient deficiencies, all those things will impact sleep. So we want to make sure we address those things. So how did we create sort of the good enough bedtime routine? Because bedtime was chaotic. Like literally, mom, sometimes dad, of course, Jake, they end up in tears at the end of the routine. So we really needed to create that sort of calming, good enough bedtime routine for them. So the first thing we did was with the non-negotiable. Jake needed to be in the bedroom by 8:15 p.m. That was a non-negotiable. The second thing when it comes to those non-negotiable was safety issues. So we had him take some medications because of his ADHD as well as sleep supplement. He needs to take his supplement by 6:30 and his ADHD medication by 6:30. So we made sure that was a non-negotiable. We had to make sure that was something that was established. There was really no arguing about that. And then the third thing was to stay in the room. So that's around safety, staying in the room after bedtime. And then, of course, the hygiene piece was he sometimes would choose to just brush his teeth and wipe his face. Sometimes he would choose to brush his teeth and take a shower. That again created some kind of autonomy and flexibility in what we did. And then in terms of the sleep anchor, what they chose was to dimmer the switch. So after dinner, the lights would just start to go down about an hour or so before bedtime. And then there was an Alexa, which would play an automated playlist of about five songs or so. And so these were things that would just be playing in the background with the dimmer switch to start to get him to wind down. So those were the two anchors that we used. And then with the flexible, bedtime menu, there were options that would change, I would say, every few days. So sometimes he would say he wanted to, the parent would offer him 15 minutes of audiobook where he would listen to a story. Of course, nothing too stimulating. Or they would do breathing or stretching with mommy or breathing or stretching with daddies, right? So that was something he got to choose. Or just quietly playing with Legos, which is really fine. So they would give him that menu, and then he could choose what he felt he wanted to do on that day. And so that really brought around so much autonomy that within a week, bedtime was a dream. Bedtime was a breeze. All of a sudden, parents had bought back an hour of their time. Bedtime routine used to take 2 hours. Imagine 2 hours. So all of a sudden, they had all this time back. They literally could now just wind down like they should, right? So that's really the power of embracing good enough rather than perfect, right? This was a family that had been struggling with making everything super perfect in the past, and it really wasn't working. So you have to know your child and decide what is really important to you. And I think good enough bedtime routine is absolutely good enough. So I think here are some principles when it comes to talking about the good enough bedtime routine. Number one is consistency with the timing. So you don't want to have a bedtime routine where some days it starts at 7, some days it starts at 9, some days there's no bedtime routine at all. You really want to try to stick to a consistent time. Then the other thing is, remember 2 or 3 things that signal sleep, not 8 to 10. So don't bring a whole laundry list of activities. They go upstairs and then go downstairs and then they go outside and then they go to, to the kitchen. No. You really want to keep things as simple, as straightforward as possible. And then number three, I would say, is give your child agency and autonomy. Let them choose. Of course, you're still setting those boundaries, but within the context of the boundaries, let them still be able to make choices about what they want, right? When they have a say in the matter, it is so empowering. And most children tend to do better in that kind of scenario where they actually get to choose what they want. And then number four, I would say, is adapt to reality, right? Let's literally call a spade a spade. Like our lives, right? Life is life thing. You might have a really hard day. Jake might have a really tough day in school where everything falls apart. Be willing to adapt, be willing to be flexible in those kind of situations and give yourself grace. We are not chasing perfection, we are chasing progress, right? And then finally, learn to redefine success. So instead of we have the perfect bedtime routine and the perfect bedtime, let's say we're becoming more confident, there's less bedtime conflict, and sleep comes easier, right? That might be what we need. So redefining success is important. And then finally, of course, you want to pay attention to what the red flags is, because those red flags are not things that a bedtime routine will fix. If you have a child who is snoring, you have a child who has restless sleep, you have a child who's taking hours and hours to fall asleep, even though you've done everything that you feel you're supposed to do, you probably want to get checked out, because sleep apnea, restless leg syndrome, narcolepsy, there's so many other sleep disorders that occur in children and are actually more prevalent in children with ADHD, which you do not want to miss. So I hope this has been helpful. We have talked about what is good enough. And I want you as a parent to know that you are good enough. You are not failing. Sometimes the sleep advice you've heard in the past is what's failing you. And it is time to redefine what success means when it comes to bedtime. And I want you to know that you are the best man, woman for this job. And your child is so privileged to have you. And so if you are looking for help where you say, we've done everything else, we need that extra support, we'll be more than happy to help you at the Restful Sleep Place. Check out our website, therestfulsleepplace.com, and let's get your family sleeping. Until next time, I hope you rest well.